Eleanor?
Sure. Although I think I didn't time. I was going to actually time it if it was 2 minutes.
Yep.
No, it was good. I told them, I showed the this thing, thanked everybody, and then whoa, wait, this is actually weird. So our TV is.
Oh no!
Is this going to keep happening?
Oh.
They've cloned you so you don't have to, so you can leave now. See?
Right, I should show a video during these things. Next agenda item. Thank you, RCTV.
Thank you.
To know. Yeah, so talked about that and then talked about the updated order from August 7th, which by the time of August 11th was like surpassed by another order that had come out. And Bob mentioned that the map of COVID risk shows Reading as one of the ones that has fewer than 5 active cases, but we're sort of surrounded by other towns. So great. And we're surrounded by other towns that have a little bit higher. So, you know, we can't get too comfortable, but we can be glad with where our risk is now. So that was
Viruses don't care where you live, or
exactly. They don't.
No. Sorry, I didn't mean to interrupt. That's just like
I
knee
was
reaction when I hear that.
No, then I was just saying, I said goodbye to folks, let them know that I was resigning and that would be my last select board update. And that they get to meet one of you fine folks next time. Or see, not me, they know. Okay, I see Laura's on, and then Paul is off this week. So I will go ahead and call the Board of Health meeting to order at 7:02. Anyone want to take notes? I could do it if no one. Okay, I'll do it.
I would, but I have about 6 or 7 to go through still.
Okay. Well, while we're actually talking about notes, Jean has a spreadsheet, and I was finally able to get through it and see there are maybe 6 meetings where we don't know who was the note taker for those. So maybe we can send you the list and see if it's some of those. So I will be the official note taker.
Probably me.
Yeah, well, I wrote like 5 times. Eleanor's got these. Eleanor's got these. So I sent Jean some drafts that need to be cleaned up. Laura, I think I sent those to you too. Okay, so I will be the note taker tonight. Right. Open for would anyone like to make any comments? I don't see any members of the public here except RCTV. All right, any updates or discussion points from any board members or Laura or Jean? No. Okay.
Eleanor, I just want to, in preparation for our reorganization meeting on Monday, I wanted to let folks know that I will not be a candidate for chair. I don't know if that was in anybody's thoughts or plans, but that's not something I can entertain at this time. I'm doing 2 people's jobs right now. So it would not be responsible for me to do that. So.
Okay. Thank you for letting us know. Great. I think all of you would make fantastic chairs. And Carrie, I'm glad to know you're that choice and what works for you.
So do we know if the position's been posted, your seat?
I don't know that. Well, I was on the website yesterday and it said I'm still a member, which I am technically till the 17th.
Till the 17th, right. But if you've already given them a formal resignation, I think they can start the process of filling that vacancy. The only reason I bring that up is by default, that's going to make Paul a chair.
Yep.
Richard and I can't serve as chair, as associates.
Right.
Right.
So it's one of those, everybody take 2 steps back except
Yeah.
Paula deals.
That'll teach Paula not to go on vacation.
Right.
That's right.
I felt badly that was, yeah, she's out. So she doesn't know that she doesn't know what she's coming back to. But, yeah.
It may not hurt, Eleanor. I can't remember if you sent an email to the town manager's office formalizing your resignation, but
yep.
You did, okay.
Yep.
Okay, good. Because sometimes that gets to be a picky detail, so that's good.
Yeah,
That
so maybe
same-
we should get the VASC on that ASAP, Gene, then.
Yeah, I think there's a built-in system that I'm not even involved in that, once they get that written, notice, they put it on for the select board. But the
Okay.
select board doesn't meet till September 9th.
Oh,
So that means there won't be a replacement until
That
then.
would be the
Or can
first
they-
the VASC can meet before then and put forward a candidate, and then they have to confirm that on their next meeting. They could, within 48 hours, if they choose to call a meeting specifically to appoint somebody, though.
Yeah, okay, that's good to know. And it kinda
Sooner, so.
Yeah, it kind of seems like when did you say September 9th?
Yeah, I think that's
Just, I mean,
So-
I'm thinking like 3
Sorry.
weeks with no,
the day after Labor Day, September 8th.
yeah.
So my suggestion might be, well, Carrie's not going to like this. Are you the vice chair, Carrie?
I
We
think
don't
we never
know.
actually formally chose a vice chair, so I don't think we ever did that.
You
We
can
could do
choose not. You can choose not to reorganize, and it would leave one of the voting members to play the role of the chair until a reorganization can happen. So in other words, if you wanted to theoretically wait to see who the candidate was, and if they have interest in it, if Paula doesn't, just an avenue that you can go. You don't have to, if you don't formally reorganize, it default goes to a voting member to take up that responsibility.
interesting.
Yeah,
We can discuss
We'll
it
talk
more
about this on
Monday,
Monday.
just to put it in your heads. Yeah.
we could. I mean, I guess if we want if we wanted to change the actual agenda and not do a reorg that day, then we would want to do that 48 hours in advance of Monday. But if we want to instead, I mean, right now it says there's a reorg on the 17th. The posted agenda says that. We could just,
We can't change the
Defer.
agenda.
You can't change the agenda, but you actually don't have to vote on it. If nobody
Right.
makes a motion to reorganize, then there is no reorganization. So we can just discuss it, and that can be that.
Yep.
should I communicate with, so I did also send that notification to the chair and the liaison of the select board, so they know, but should I also circle back and say, we understand that your meeting is not till September 9th and don't know if there's any way to, I guess, have you call an extra meeting to consider candidates. We don't have any candidates currently.
Yeah, you want me to call Mark?
I think Mark said on Monday's meeting that there were that they had 3 potential candidates, but none of them
Awesome.
do
Yes.
Monday mornings.
Correct.
So that if one of those, served, then we'd have to decide on what to do for Monday mornings. That was in the context of changing the frequency of the command meetings.
Great.
Correct. That was, yeah, Bob reminded us of that. Yes.
Great. Okay. I was confused about whether those 3 were new 3. So, okay. Okay. So we will revisit on Monday. Got it.
Got lots to talk about.
Any other thoughts, comments? No? Okay. Health agent report. So it is almost our first Thursday of the month.
Hello. Okay, I went a little bit more detail than usual because I guess I don't fill in any gray areas, but so if it's too much, I can take it out for next time. So we attended I attended all the Board of Health meetings and some meetings with the chair and a meeting with the new member. So that was 29 and a half hours last month. I did my weekly report of COVID cases to Incident Command and the Board of Health every Wednesday. I reported daily cases of COVID, whether opened or closed, for tracking purposes to the first responders to ensure safety. I attended 2 DPH calls per week. I attended weekly emergency preparedness calls with my group. I met with inspectors and nurses as needed. I didn't count those. I can for next time if you want. I entered payroll. I maintained vacation, sick time, and insured coverage for all individuals. I reviewed guidelines that were released by the DPH. I sent new guidelines, checklist, inspection report to the Board of Health for review for a tattoo location after reviewing them with Daniel. I attended weekly EAT meetings that have come to came to an end this week, I believe. But so they will be on my August report. I oversaw and reviewed the tobacco inspection and the food inspections. I met with mosquito control and forwarded the information to Jane Wellman, who did a reverse 911 for the 2 mosquito sprayings that we did this month. I conducted and met with entire staff and conducted all my yearly reviews. So I even had to drive to one woman's house to make sure I did her yearly review. So Daniel's yearly review's done, John's, Maria's, and Christine's. And I will be sitting down with Jean and Christine, I think next week or the week after, to formalize Christine's because hers is a 6-month. I conducted the YMCA camp inspection. I conducted, addressed, or reviewed 47 complaints. We facilitated and ordered storage of masks. I approved mileage request forms. I approved public health nurse meetings request reimbursement, ran 2 complete Maven audits with the nurse, and reviewed tobacco location. All the tobacco locations were inspected in July, and those were all reviewed and filed, and there were no violations issued. And I think I left nothing out, but I might have, but that's the highlights. Any questions? A little too much information, or? Did I lose you guys?
wonder, Laura, the 47 complaints.
Yes.
Do you have a sense, what were those about? I mean,
Different things. I'm home. My neighbor's not cutting his grass. Could you cut it? There's an abandoned property that isn't cutting their grass. There's a foreclosed property that isn't cutting their grass. People are going into certain stores without masks. Or like one particularly large store, I got a couple of calls, possibly by the same person, possibly not, that they had taken down all their shields at all their registers. So we have to go and check every single one of them. They are not always accurate. Sometimes they are, but they're always inspected.
Were those the same? So we'd heard that, I think, previously from grocery stores.
Yeah.
It seemed like the same.
Right, because I'm reporting on July.
Okay, so this is the same set of complaints.
Yeah, all 47 were in July.
Okay, and so do we have a sense of how many of those were COVID related? Is it like half of them or most?
I don't know the answer to that question because I can't access the shared drive because there's something wrong with the, neck extender that has to be fixed on the computer. So I don't know the exact number for that. Off the top of my head, I would say half.
Half, okay. And then half are for the, I don't know the technical term, like the vegetation kinds of questions, or are there food inspection ones in there? I'm trying to
actually, there was no food inspection ones.
Okay.
That I recall off the top of my head. I don't believe there was any food inspection ones. There was 2 or 3 I know were abandoned properties, and because I remember 2 or 3. There was one lady didn't clean out her pool.
Okay. Yeah, I think it's really useful to have a sense of generally what frequent types of complaints that we're hearing are. I think that's useful. And then you said that the weekly EAT meetings have now ended. Does that mean?
Yeah.
What does that mean?
Well, I think you canceled them all, right, Jean?
Yes.
So is that for the civic function permit review, or was that only for outdoor dining? Will you remind me?
And what did each stand for?
Expedited approval team.
That was just for outdoor dining though, right?
Right.
Okay, so the civic function permit team that Laura is on is a separate
That's separate.
review
Oh,
process.
I forgot to add that to my list, sorry. See, I will add it to my list for next month.
And then I think I just had one more question. Oh, the continue to inspect tobacco and conduct all food inspections. We used to have I think the number of inspections and re-inspections because the state, I can't remember where the documentation was, but was at liberty to request how many initial inspections and re-inspections we'd done.
Yeah, did we ever find out if that actually happens? I was curious about that. I've never, in 12 years, I've never actually heard that. I was wondering if anybody knew that. But all tobacco, I don't know the number off the top of my head, all the tobacco locations were conducted.
That's great. Yeah, I think I was just asking about, we used to have a number for, there were 3 inspections and 2 re-inspections for food, and then for Maven,
Right.
we would get those
And then,
numbers as well.
yeah, and then when we talked about this at the last Board of Health meeting that we were talking, not this month, last month, I thought you didn't want the numbers in the reports anymore. Oh, going back to the numbers in the reports, it's not a problem at all. Or numbers or reports, whatever you guys want.
Oh, I don't remember that. I know I would have remembered that because I love reports, and especially
Yeah, I thought
love reports
there
with
was
numbers.
a discussion about cutting down what the board did and slowing down the meeting, so I thought that was one of the things. I can send them all out. You guys can have all the reports you want. I'm more than happy to.
I think, and I understand that you're trying to give us all the information.
Whatever you need.
Yeah, so that we have it and can all be fully informed. And I appreciate that. And this will be a process of figuring out, exactly the right thing to include. Previously, we had numbers on the health agent report for, X number. I'm giving the example of food inspections, X food inspections, and X re-inspections. And I can look back at an earlier report if that's helpful. And I know that we would have the numbers for Maven. And then with food inspections, you would also scan and send the PDFs of the actual inspections themselves, but not include that in the packet so that.
Right, I did do that, but I thought we weren't doing that. I can do that anytime you want, whatever you guys want. I didn't give you the numbers for Maven because you get them every Wednesday. And actually, Eleanor, you get them every single day.
Yeah, there's a couple. Yeah, we can talk offline about that. There were a few.
Yeah, no, you missed the one for this week because I actually had Paul Jackson send the email out yesterday because I wasn't, I was at class when it was time to send it out.
Yep, I saw that. Thank you. So I tried to write down everything that you said so that I can look.
I can send it to you.
The scans of the PDFs of the food inspections. Is that what you're saying?
You want the scans next month in food inspections?
Sure. I mean, that was sort of the way that we used to do it. And then, but I'm not saying that we're necessarily deciding a precedent right now. I was saying that I've, tried to write down everything that you said. I know last time we used to get the health agent report in writing. So I know that you want to get to a place where we're sure about what the health agent report is, and we have a new board, and I know you'll have a new chair soon, Monday or another day. So if it's helpful, I can try to come up with a template, based on the report that you used to do. But for now, we might as well continue the process that we had before, I think, which is to forward those food inspection reports. That makes sense for the board members.
Can I make a suggestion? Just because it's changed so many times over the 3 years, when we get a new chair, why doesn't that person pick what they might want?
Yeah, no, I think that makes sense. I think
But until then, I'll just compile them. That way we have them for next month, though.
Okay.
So I'll scan and attach all the food inspections and re-inspections.
Okay.
So is there not a written summary of what you just reported out to us, Laura? Because I would love just that high level of 47 this, but that I don't. Is that not in written format?
What I just reported?
Yep.
I have it in my notes. I can type it up
Okay.
and send you an email. It was just my report, but that's not a problem.
Yeah, we used to do, yeah, Laura and I was just trying to be clear to go back to the way that we were doing it before COVID happened, which is where we got a written health agent report that was in the packet. And, you know, we haven't made this clear till now, so I'm just clarifying now. And then the food inspection reports would be forwarded to board members, but not included in the packet. So that was the way that we did it before COVID. And as we return to a new normal, we could continue doing that way. And if the new board under a new chair had changes, they could make changes at that point. Does that sound right to everybody? Basically continue with pre-COVID reporting. Okay.
Yep.
Laura, sound good?
Sounds great.
Okay.
Easy peasy. I'll compile them as, well, it's easy because we're only like 13 days in, so I'll just grab those 13 and keep adding to them. So no problem.
Okay. I mean, I did appreciate hearing everything. This is more extensive, as you'd said, than the previous reports. So just letting you know, I appreciated hearing all that. Yeah. For what it's
Good.
worth.
Thanks.
Yeah, and it would be good to see it on a on paper too, as you're going through it. I agree with that, because it was a good amount of information, but it was good information.
Yeah, it was great.
Minutes.
Eleanor,
Yes.
I don't seem to have an agenda. I don't know if I missed an email. I have the addendum document that was sent out, but is there an agenda that I'm missing somewhere?
Yes, no. So moving forward, we're going to only have the meeting agenda that's posted on the town website rather than any other agenda that I send out that's not 48 hours in advance. So the link at the top of that email that Laura forwarded you earlier is the link to the Town of Reading posting for this meeting. And that has a bullet pointed agenda that's, I think it's like 4 or 5 items for tonight. Do you see the link that I'm talking about?
I printed
Or
out.
I can probably just pull it, or here, I can share my screen for a second and pull it. So instead of getting like a bullet pointed list with indented other links. So this time, for example, I wanted to include some links, but the meeting had already been posted. And so we're just going to work to try to get everybody on the same page at the same time so that this agenda that's posted can be as extensive as possible. But this is what we have. So I will no longer be sending out anything else.
That's fine. That's fine. I wasn't.
Yeah.
I didn't
Sorry.
understand what was happening.
Yep.
Thank you.
Yep. No, thank you for continuing to readjust. As again, you've been, what is this, like your 9th meeting or something?
No, this is my 11th or 12th. So
I figured it out. I think it took me a year to figure out all the details and where everything was posted and how to access RCTV videos.
yeah.
So not to go down this road any further, but I didn't get the link either.
Yeah, I don't think
Again,
I have
and last, one of the things I said last time, it's really helpful in preparing for these meetings, and it'll make them run a lot faster, smoother, shorter, if we're prepared. So if someone's going to have, it doesn't matter the format. It just needs to make sure it hits us as soon as it's posted as well.
Yes. Yeah.
Mhm.
Yeah. I found the message. I don't have a link. I just have the 2 attachments. That's why I'm.
Same with me. Yep.
Okay. Yeah.
So yeah, I think this was an issue where there were a couple of people who were posting the agendas, and then it got posted, then reposted, and then the one with the link for the posted meeting didn't get posted. But the email, let's see if I can just send it.
So would the board want,
Mondays would be good to have today, would be my
Great.
point in saying that, because Mondays is already posted.
for me, I'm wondering who's going to do
Or is
that.
it, Or is it just jump on the website?
Well,
I mean, that's fine. If it's going to be up on our website, I don't mind jumping on and grabbing it. I just, want to make sure I can access it.
yeah, let me see what's up there now. So I sent the August 20th agenda last Friday, but I have not actually made an August 17th agenda, just because we talked at our last meeting about what should be for tonight and what should be for the 20th. So has everybody, I don't know if you all have seen an August 20th agenda.
Nope.
I've just been relying on email. It would be, which, yeah, as like Kevin says, I'm happy to jump on the website. It would help if I got a notice that an agenda had been posted. I don't know if that's possible. Maybe I just need to change my settings on the Connect Red or whichever system we have. We can do that.
So I'm happy to, because obviously I'm going to be reposting all the Thursday agendas. I copy Eleanor when I send it to the town clerk. I can copy the full board if that works. Because I'm sending the email anyway.
Yeah, I'd make sure you just blind CC us though, Gene, just for
Can you add Laura too?
functional standpoint, so people aren't replying.
Yep.
Yeah.
So I'm going to be posting and notifying the board. That's going to be me, right? Okay.
And Laura, please.
And Laura.
That would be great. Thank
So
you.
now, when the chair and Laura decide, like, I know this a lot of times I'm not involved in that. Is that going to be now another email from Laura with minutes and other kind of details?
Yeah, so I'm glad we're talking about.
Yeah, we always used to have it that Laura sent us the
Right.
packet. Am I
One email
misremembering
with
that?
everything.
So I
Laura,
had sent
right?
Laura the agenda
Right.
for the 13th and the 20th. And it looks like the 20th that's online is not the agenda that I sent to Laura. So I wonder if maybe it would make sense if we went back to that way.
Right, but I sent it to Jean because Jean's posting them. I can still do the minutes, but Jean's posting the agendas.
Laura can
So-
post. I'm happy to back off.
So we're putting too many wheels into the equation here, which can lead to miscommunication and the wrong thing being posted. I think the simplest way is the chair and the health agent should come up with the agenda. The health agent should then post it.
And circulate it.
Yeah, it's simpler that way.
That's how we always used to do it.
That's exactly how we always have done it
We'll go
since
back
I've been
to
on the board.
pre-COVID on posting, on everything.
Yeah, I just
Okay.
don't want it. I just don't
agree.
want anything to get lost going over the Gene, and then I think it's one more step that is not needed.
Yep. Laura, are you okay with that?
Yep.
Okay.
So let me know about the 20th if you need me to resend that one or anything. It looks
I
like.
think you already did that one though, right, Jean?
Well,
No,
the one that's left is just a one item COVID-19 discussion, not the bullet pointed list with all the links in it.
Oh, okay.
So you-
So yeah, send me a new one from scratch so I don't pick up an old one or anything like that.
Okay. And
the
then,
thing is, I try and get those posted Monday after command because the town clerk is extremely tied up with elections and it's really easy to have that go off the rails.
Okay.
It's better if we can post it, the week before, because right from now till the election, really in November, town clerk is extremely short-staffed. We can't wait till the last minute.
Yep.
That's why I got everything
And,
posted.
and all the Zooms are already set up and it's already posted, so we just have to post the agenda, so it's,
Great, and you'll have
half
to
the work.
film too, Laura. 'Cause
you have to take down the Zoom that's already there?
No, you'll have to, going forward, you'll have to coordinate the Zoom meetings.
Mhm.
Because you're posting everything, so you have to put all the Zoom information. That's why I started doing the posting, because of Zoom. And it's it's not my personal, but it's my Zoom account that we're using, so we don't have any time frame issues. But that's how I got involved in posting.
Got it.
But you can just post the same Zoom number. It's the same.
Could we though, if you're not hosting the meeting, I mean, if you're here, then you could still be hosting the meeting. If she uses the same Zoom information.
Well, Laura, are you going to start using your camera now that you have the new laptop?
No,
Well, you're going to be hosting the meeting. I'm stepping back. So I think you're going to have to. You're
I don't
gonna be-
actually have to. Yeah, but you don't actually have to be visual.
Right. Is it fine for her to use that same Zoom account number? Since it sounds like.
Plus, you're still going to be at the meetings, right, Jean, anyways?
Yeah, I was still planning on attending. Yep.
So we can still use the same number, it's fine, right? It's already posted, we don't need to take it down and redo it, we'll just need attach the agenda
No, it
and
has
just
to be
keep
an
using the same numbers.
it has to be an updated, whole new document. But you
But I think what Eleanor was saying was, can we reuse the same Zoom number?
Yes.
Okay.
Okay.
The only thing that could get fouled up is if a new date is chosen and I'm using this Zoom account on another meeting, but hopefully that won't happen.
Right.
Because you can't have 2 meetings on one Zoom account.
Right. So at some point it would make sense.
Right, but you're going to be at all the Board of Health calls, right? All the Board of Health meetings, right, Jean?
Well, it's very likely that this calendar is going to change because the 3 people that applied already said they can't meet at 10 a.m. on Monday. So depending on how the time, the board meetings shift, that's the only wild card at this point. Who knows?
All right. So we can talk, Laura and we can talk offline then, it sounds like, and figure out if we need to do a new Zoom account or if Jean is fine with us using that one for the duration of the ones that are already posted. And then, if we need to change moving forward.
Fine. It's just the question's going to be September.
Yeah. Okay. And then just to let other board members know, so since there's not a specific agenda for 8/17 and town hall is closed tomorrow and the next 2 days are Saturday and Sunday, there's not going to be any more information forthcoming for the Monday command meeting. So maybe at the end of this meeting, we can do like a summary things that we think are going to be on the agenda, if that's helpful.
Got it.
Okay. And
Okay.
Laura, I'll resend the 820. All right. Any more comments? All right. Let's go to meeting minutes. So I did have a chance to review all of the 6. Thank you guys. I did have some questions about all of them except for 7:30.
Let's start with 7:30.
Okay. Deal. Motion to approve meeting minutes for the Board of Health 7/30/20 meeting for the July 30th meeting.
Second,
All those in favor?
Carrie, yes.
Oh, Eleanor, yes. So procedurally, since we have a quorum, is 2 votes fine, or should I elevate it to a voting member? Great. Okay.
2 votes is fine. You really only want to elevate somebody if there's going to be something that's going to be voted on I won't say major, but of certainly of out of the ordinary board stuff.
Okay.
Otherwise, 2 votes is fine.
Got it. Thank you. All right. And then Laura, I can just send you the edits that I had to the others.
We want to go through them now with everybody. That way everybody knows what they are.
I can, or we can notate them in yellow the way that you've done for the other ones. Do board members have a preference? To either, I can talk through the edits now and then you can receive an updated version that's yellow, or I can just work with Laura and she can send you an updated version with yellow indicating changes.
I think the latter makes more sense rather than spending time going over minutia.
Great.
Agreed.
Can I ask a question?
We're not talking about 1 or 2 items, right? You have a few that you have to go over.
For 6-8, I only have 2.
Yeah, I think, if it's simple editing and stuff like that, just go over it and then you vote as amended.
I think that'll
And then
work.
get it
for
to, and then get it to Laura. But if it's
Yeah.
something of substance that maybe someone wants to discuss, then you should probably hold off. For the most part, I think it's it's fine to do as amended. It's usually quick things that people are editing. It's editing things, right?
Yep. I mean, I think for
It's
Yeah.
there kind of stuff.
mostly.
Yeah.
I mean, and
So-
yeah, so I mean, for 6-8, I just had a couple of comments. So I think I just wanted to verify that the draft was emailed. Let's see. Oh, maybe I thought that one was fine. Trying to understand my notes here. Changes in yellow and others from before. Oh, those are all okay. Sorry. So 6-8, I think is fine too. I didn't have any changes for that. Motion to approve the meeting minutes for June 8th.
Second,
Roll call.
Carrie, yes.
Eleanor, yes. And then the rest is things like the changing Christine's spell with a CH to a K. There were a couple questions I had, like not disinfecting or no proof this is helpful. I wasn't clear, and I think needed somebody to go back to the video just to make sure that something was as indicated.
Yep.
And then actually, Carrie, I did have a question for one of the ones that you submitted or on the 7/16.
Yeah.
It was when I think we had talked about the reopening protocols or no, this was a civic function permit. And
Yep.
you, in the meeting notes, said that we had agreed to add an addendum to the civic function permits that related to signage for social distancing, hand sanitizer, having one-way aisles, gatherings, indoor-outdoor gatherings, and then a 25% maximum occupancy.
Mhm.
And what I did was not that. So I
don't remember that. I don't remember that. Yeah, I don't remember that detail. So I'm sorry if that's what I typed because I don't remember. That's not what I recall on the thing. So.
Yeah, I wound up doing the fourth main categories of the hygiene and social distancing and training, I think, and something else. Not training. I can't remember the 4 now, but it wasn't those. Like I didn't have a thing about hand sanitizer on there, so I don't know if it would make sense to look back at that.
This is 7/16.
Yep.
What about the section that there's nothing on? Second
That-
page, halfway down. Jean, I have nothing written here. Enforcement.
Yeah, I provided.
Yep, I have
comments
that
on
comment too. Yep.
I provided comments on that. I
don't
went
think
through
I
the
have that.
tape and,
Right. I remember you said you did that.
yeah, I sent it to Laura and I think I sent it to you, Carrie.
Okay, that wasn't the copy that I had. Still had
Me neither.
enforcement. I have nothing written.
Yeah,
here.
I sent it to you, Laura. I sent it to you and Carrie. After that meeting, I went back and reviewed the tape and I made some suggestions.
Find your email.
Well, why don't we then, so for 6/15 and 6/22, I can work with Laura to make those amendments. And for 7/16, maybe the updated draft can be recirculated because I don't think I've seen that one.
Yeah, I'm gonna have to find Jean's email. I remember her sending it. I didn't put it in then.
Okay.
And which one did you just approve? 7/6 before?
6/8 and 7/30.
Six eight. Oh, 6/8. All right, I'll update 7/16 and we'll work on the other ones next week.
Yeah, so I'll send you comments for 6/15 and 6/22, and then if you all can recirculate the updated draft of 7/16, that would be great.
I just sent it again.
Okay.
Thank you.
Thank
Did
you.
you get it, Laura?
Yep.
Okay.
All right. So COVID-19 discussion. So I do have some notes here and an update from town council. I also have some other updates, things that I've heard. I have a couple complaints that I think we can talk about how we want to address and going forward. So I'll start with update from town council. So that was the addendum that we sent around before, where this was in response to Kevin's question to clarify whether or not there was anything extra related to giving COVID fines, if we were deciding that fines were the way to enforce people not obeying things like the gatherings order. And so town council wrote back and cited these different regulations. So the section 20.2 was actually from that's on the town website for the health regulations, where if anyone violates them, it's $50 for a first offense, 100 for second, and 150 for third. But if it's something that is against the governor's order from August 7th, that's effective last Tuesday, that's enforced both by local boards of health and by police, and those fines are up to 500. So we as a board haven't discussed what we would actually fine. And then the fourth part is from section 21D of Mass General Law, which is about how citation would need to be in triplicate, and kind of logistics about it. So things have changed. You know, we've been continuing to have this what does enforcement mean discussion, because I think you have to make those choices if you're going to continue to have people filing complaints. Then at some point we need to say, okay, well, if a complaint has been filed 3 times against this business, at what point do we actually step in and give fines? So the governor has given guidance or given regulation about the amount that someone could be fined. And now also, in addition to the health department, the police department will be I don't know if the word is at liberty or obligated to put those fines into place too. So if someone's having a large gathering, then the police may get called, and the police may be in the position of needing to enforce those orders. So I don't at this point have a recommendation about what the decision is for moving forward, but I know that this is going to come up, and as a board we need to talk about and think about what Laura and Dan and John, and I don't know if John would ever be going on these, but what do they do?
Well, and wouldn't we also have to have this conversation with command, because it's COVID and because we're talking about joint authority to administer fines with public safety? So I think we ought to have ourselves kind of clear, but then we need to further, present that information to command and I guess ask for their comment, buy-in.
Yeah, and I mean, the Chief Clark, Chief of Police, is part of, is he part of command? Yeah. So I know that on the select board meeting, I can't remember Amendola's, I think Lieutenant Amendola.
Yep.
She said that they, just that day had been learning more about what implementation and enforcement means from the states. They're going to be continuing to learn more about what that means, and I agree that it makes sense to have for it to be a conversation that we have with command. I mean, the way that we have dealt in the past with offenses, like because the tree lawn pesticide is on my mind because it's on the agenda, we really went about that with the first offense being an educational one where someone was handed a copy of the regulation, and then the second, third, fourth offense were fines that were increasing up to 150 for the third and each subsequent. Yep. So it could be that that's the structure that we adopt now.
I would agree with that approach. I always like to quote Cheryl Sparra with the the reminder that enforcement, the goal of enforcement is compliance, not punishment. But that certainly we have the ability to, but we always want to start with, obtaining compliance and making sure folks know for a first offense that.
Okay.
Yeah, it's also very consistent with what we've been doing as well too, which is always easier to follow from a staff standpoint.
Yep. Okay. Oh, Rick, you're muted.
I think given the fact that, we're doing relatively well with respect to COVID, there wouldn't be a reason to increase the fine structure or be more aggressive. I mean, I think if we were in a hotspot, maybe, we'd have a different conversation, but I would agree I'd use the same structure for the COVID violations.
Okay. So do we want to keep this conversation, like we've heard one another's thoughts, do we want to keep this conversation open for now? Does anyone feel like we want to make a motion at this point, or?
Probably do that Monday, because you should bring it up again, just to with the Chief Clark, and let him weigh in on it and tell him what our thoughts are, and see if he's good with that, or if he has some different thoughts on it. And you could always make a motion at that point in time too.
Yeah, I think that sounds good. Great.
Is it possible to communicate with the chief in advance so that we're not going on a sort of reaction? But sort of here's the board's thinking on that. I don't know if that's possible, how we go about that. No, Jean's shaking her head.
No. Oh wait, you're muted, sorry.
Lieutenant Detective Abadi is filling in for him this week.
Okay.
Should I email Lieutenant Detective Abadi?
Well, I don't know that we're in any need to implement this ASAP. It doesn't sound like we have offenders that are going on that are going into the double, triple, or worse category. So we could always just put it off to the following week's command meeting.
Chief, I believe Chief Clark will be there on Monday.
Oh, I thought you said he wouldn't be there Monday.
No, I was meaning in advance. The comment about, I misunderstand, you were thinking maybe.
Oh, okay.
Yeah. So the chief is off this week, and I was in a meeting with Lieutenant Detective Abadi today, and he said that he wasn't even really sure. They were waiting on something from the Mass Chiefs Association of what the parameters were. So probably by Monday they'll have.
So why don't we hold off? If it looks like you can take a vote Monday, you can. Otherwise, you can push it to another day.
Yeah.
Great. Let's see. Sorry, I have quite a few notes here that fall under this COVID-19 discussion. So regarding complaints, so I mentioned complaints, we've been talking about what the fee structure or fine structure would be. I have heard some complaints from residents who their kids are playing ice hockey, and they were concerned with the coaches not wearing masks and the students being sort of shoulder to shoulder, not being able to maintain that social distance. And at first I thought, wait, why have I not heard about this? But then realized it's because they're not on permitted property. They don't have to get a permit from the town to have ice hockey. So I think we need to think through how, just be aware of that and think through that. The way the state has set it up, it's really complaint based. And so these residents were able to contact me just because they knew somebody who had my email address. So, I want to protect their anonymity, and I understand that we need to be able to protect the anonymity of families who want to maintain good relationships with all the families that their kids are playing with. So I think my understanding is that the complaint system that we have now is, Laura, can it be anonymous or is it not anonymous? So like if someone wanted to have done this through you rather than me, would they have had to say their name?
Public record. If official email is sent to the Board of Health or to Laura's official email, it's public record. So if it's not signed and from somehow they're able to hide their email, then that's the public record.
Yeah, but if they call in, they can call in anonymously.
Okay.
Like some towns, you can't call in a complaint. You have to go and physically bring it down.
Oh,
Okay.
interesting.
So if they call the town telephone number and then they enter the health department extension, which I think is 7, then it would come to you and they could just not leave their name or anything?
Correct.
Great. Okay.
And that's why there's a lot of, sometimes there's a lot of duplicates or triplicates or incorrect.
Yeah, and I think we talked about that briefly. It's a very tough subject matter, right? Because you do want them to be real and factual complaints without somebody's name being tied to it. It's difficult, but it's also difficult to get the complaint if this thing you have to tie someone's name to it. It just keeps going round and round. That's kind of that circle. So
Yeah.
it's tough. It's tough. Laura has to chase down every complaint, and a lot of the ones that she chases down just weren't true. You get that a lot. So it's, it's difficult. I think that's why it's good to have in these circumstances, hey, we got a complaint. It was anonymous. They were saying this. We're not saying you were doing it, but just so you know, this is how it has to be done. And that's really kind of, I think, what Laura's done over the years when she's handled it with different entities around town.
Right.
So it's great to know that those can be filed anonymously. What in this instance, what do we do? So does Laura go visit?
Laura should
hockey
take a visit or
you know?
have a phone conversation and just tell them what's been told to us and how things are supposed to transpire.
I have not received any on the ice arena, just so you know.
Okay.
So it was just people gathering on the ice without masks? That's the...
No, it was an organized ice hockey, I think, tryouts. And the coaches were not wearing any masks and the students were shoulder to shoulder. So there was definitely no social distancing.
So it sounds like
a game.
So the shoulder to shoulder sounds like when they were on the ice or when they were on the bench, most likely. Was there specifics?
I don't remember whether it was on the ice or on the bench. My assumption was it was on the ice, but maybe they didn't say that.
So most of the protocol doesn't have them needing to social distance on the ice, but rather than on the sidelines, unless they're standing around, unless they're just standing there.
Well, I also don't know if you guys had a chance to see I just sent out like 3 minutes before this meeting, there was updated sports guidance that came out today that ice hockey is high risk and there's new modifications that need to be minimum mandatory modifications that need to be done for any moderate and high risk sport in order to continue to minimize spread. So moderate and high risk are not allowed to play at all unless they make modifications to the game. So kind of like how baseball
I didn't
players
see that.
Yeah, and I don't imagine that at 6:57 you're checking your email. I think you're already on the call.
Oh, here it is.
So I'm bringing up this issue for a couple of reasons. One is wanting to make sure people can be anonymous. 2 is there are definitely activities happening that haven't come before the board, and the ones that have come before us because we're permitting the fields have, done everything that we've asked of them to make sure they're in compliance, but there are other activities happening outside of what we're looking at that will be useful to well, in this instance, we want to address this complaint, but moving forward, we also want to make sure to keep tabs as best we can, let people know if they see something, if they're concerned about something, to contact us. So we want to make it available and known how people can get in contact. And I know that the town has email address now that it's COVID. RCTV actually, I think, was displaying that slide at the beginning of our meeting. It's like COVID-19 something at ci.reading.ma. So yeah, it looks like
Okay.
you all might be looking for that updated.
Yeah, sorry.
guidance. But
Sorry,
yeah, essentially,
reading the new
it recategorizes
guidance.
some
Exactly.
things as moderate and higher and puts additional stipulations in place. So some of the protocols that we've approved previously probably are no longer in adherence or in compliance with this new legislation. And I know
Okay.
Jenny sent this out.
But we've been using the state guidelines all along.
Correct.
Yep.
So,
And now the
you
state
know,
guidelines have changed. Yeah.
yeah, I mean, which is useful because, you know, you can just keep pushing that out to organizations as they change. That's the new one. You don't have to kind of reinvent it yourself.
Right.
So, so why wouldn't Laura necessarily take these new guidelines, which I haven't had a chance to read in detail, and share those with the organizers of this ice hockey, you know, group at the rink, and you know, as a sort of educational discussion, and then we can. There can be follow-up if there's a question as to whether, because if these were tryouts, then I'm presuming tryouts meaning they're going to select teams and then they're going to have a play schedule. So,
Right, which is definitely not allowed.
right. So they need to be aware of these guidelines. They're probably not. It seems like that would be the first step.
Yes.
Yep, I think that sounds great. Laura, is there a way to do that? To
That's
find out?
exactly what we do.
Great.
Sorry?
Is that
That's
something
exactly.
you or Jenna?
Jenna oversees the ice hockey rink?
No, I was thinking more about the
I-
other guidelines.
Oh.
What were we talking about? Some of the
I thought we
others,
were talking about the ice hockey.
Yep.
but the other sports that there's now some new rules. How does that get communicated?
So, but yeah, good question. There are two issues. So Jenna did send out an email to the organizations that she's been working with. So like flag football, tennis, soccer. But I don't know that she's been in contact with any organizations. I don't think so, with ice hockey, for example. And so then Laura, you had said something about that's exactly what we do. Sorry, Laura, I was just asking you to say that again.
I was talking about the ice hockey. That's
Uh-huh.
what we would do with the ice hockey. We would take the regulations down and talk to the owner of the ice hockey rink.
Okay.
But all
But is
the
that, sorry, is that in response to the complaint or is that,
In response to the complaint.
right, so that's, okay,
Okay, so right, so that's separate from just communicating to anyone who might be conducting these sports that doesn't go through Jenna is a separate issue than responding to the complaint. Thank you for that clarification.
yes, thank you.
So Laura, is there a way to get in touch with anybody who does ice hockey or any of these other high-risk sports that wouldn't go through Jenna?
If they're doing them on private facilities without coming through Jenna or the town.
Yep. Because the August, I know that the gatherings order specifically said, you know, private and public property, but even still, given the need of the Board of Health to, I mean, I think we're totally within our purview to communicate with anyone who's running an organized sport, whether it's at a private property or public property, just to make them aware that there's new guidance.
Absolutely.
I think one thing.
Absolutely, but they would have to be, there would have to be a complaint, that way we would know where they were. We wouldn't know where they were if not.
So we were wondering whether or not it's possible to just contact any organizations that run organized activities with youth. So ice hockey is one example, and share with them this new guidance that came out in case there are other groups that are running sports activities that we haven't seen because they're not going through the rec department.
Right,
So
and
one
how would you obtain the list?
I guess that's what I was asking. So you happen to know how to get in contact with the ice hockey rink manager. And I'm wondering if you also know how to get into contact with other people who are running youth sports. But
No, the only people I would know would be the people that either ask for a civic permit, go through Jenna to rent a town park or a camp.
Yeah, we don't need to know the participants. We just need to know the locations and who oversees the locations. And you have that person facilitate out to any and all parties that are going to use that location.
And
Like,
so
for
aside
example,
from
Jenna oversees a lot of locations, right? So she covers
right,
multiple sports over at all of these locations.
Correct.
Having just adding the rink into that, the person who oversees the rink, and making sure that any organization that uses the rink is given the new protocol. It keeps it a lot simpler rather than trying to come up with your own list. Find the people who oversee it and keep updating them, and they will then push it out to all the
Right, so
organizations that use it.
I agree with that. So there would be Jenna, the civic function premise, and the ice skating rink. Is there?
Right.
Can you think of anybody else?
Probably Austin Prep, because they're,
Yep.
they have
Yep.
activities that they oversee.
Mm-hmm.
Yep. Certainly, you could get out to the athletic director over there.
Yep.
I guess I could pull up the list of activities and we can. So do we have rugby, wrestling, football, basketball, lacrosse, ice hockey, competitive cheer, martial arts, ultimate frisbee, boxing, or pair figure skating? Do we have any of those?
Well, there's martial arts studios. There's
private ones, yeah.
basketball that happens. Private leagues that basketball play. Yeah, private martial arts.
So the one thing I will say is that all of these folks are itching to get going. So
Yes.
I wouldn't go on the assumption that they don't know what's going on. Most of them are getting updates from, if it's an organized Reading United Soccer, for example, that they're kind of a microcosm of a larger umbrella that oversees them. And so they're pushing information as it comes out down to them all the time. So they do get a lot of this stuff updated. It's not bad to be redundant as a town, though, and make sure that they got it. But I think that's why we're not getting a ton of complaints, is because these organizations are very well run. They're itching to get back. So if they hear an update, they're hoping it's a positive update. So they're on it, they're looking at it and pushing that information down as they need to, so people can identify with what the new regulations may or may not be. So
I agree. Like even the other day when the governor went on and said you couldn't push the high tops against the bar, all the restaurants texted me. They're like, I can't do this. I have to walk all the way around. I'm like, yep.
yeah, I mean, I think they're all very tuned into it.
Yeah, they all got the notification from the restaurant association. They all called me.
Again, it's not bad to be redundant. We just need to compile a list of all the facilities around town that facilitate these things and make sure that the people in charge get it as well, so they can push it out.
I
Taking it
agree.
for two sources isn't a bad thing.
Yeah. And, maybe it won't be two sources in all those cases. I think people are definitely doing, a great job to stay on top of it. But clearly there are some cases where people may not be aware of the guidance, but they're not following it, whether
Sure.
that's intentional or not. So,
And that's a good learning component, to come from Laura if there's a complaint, because maybe they're not understanding it as they're getting it as well, right? So it's kind of that's what Laura's role has been, and she's done a good job of it over the last 3.5 or so years, is educating the folks as to what's going on, what's going to be expected.
Thank you, Kevin.
You're very welcome.
so are there any kind of remaining questions about how to, so what we're asking Laura to do now is, in one case, talk specifically to the person who runs the ice skating rink to make sure they're aware of the guidance for ice hockey to respond to this complaint. The second issue that seems still a little bit murky is we are aware policy-wise that we think it makes sense to communicate to anyone who's running one of these types of activities that they're aware of the new guidance. The part that I'm not clear about, whether or not we actually have a way to do that. Like we've talked about Austin Prep, the ice skating rink, and then one that I wrote down and honestly can't read my own writing for. But I want to make sure that Laura knows after this meeting what it is that we're asking, like what it is that we're clear about, because we talked about martial arts, there's cheerleading, there's basketball. So what is it that we're, in an ideal world, we can communicate with all of these, but practically speaking, and Laura, feel free to join in here too, just to say what you think might be feasible.
I would just stick to facilities. You can, again, karate is one of those things, but you're gonna monitor, karate dojos as they open and close and keep a list of that. I think that becomes very difficult to do. I think you need to rely on complaint-driven basis in some of that private sector. It's not like karate is down at one spot all the time. That's where everybody in karate goes, like the ice rink. Right. So I think you need to leave some of this to be complaint driven and not even push them the information, because you're pushing it out to a private business that, may be open, maybe closed, maybe a new one coming on board. I think that's really too hard to keep track of. But a facility and the manager of a facility, I think is very doable and simple. And I think it covers a huge net across the town, like our fields, like the ice arena, like over at Austin Prep.
Right, which is what the governor's orders were saying, to go by complaint driven, because there's not enough manpower.
Right. It's you can't chase down the private sector and all the dance schools
right.
and all these other things. It'd be a lot of time, I feel, wasted to try to do that out of the health department's office. So,
but sorry, just to clarify, you do agree that contacting the owners of the larger facilities makes sense?
Yeah, absolutely. I think that makes perfect sense, because they're centralized and they cover a big net of groups that go through there. So, that you're essentially pushing it down to them, make sure the groups that are coming in here understand and abide by these protocols, and as they change, we'll push them out to you so that you can adapt to them.
So that's something that's not overseen. They don't apply through the Board of Health. So how, or is there a list of these locations?
Well, Jenna oversees all the fields.
Right. The fields would be Jenna,
so
the ice arenas, right. Ice arena, Austin Prep, those are easy. But how, are we talking all the little gyms and all the little?
No. That's it, Laura.
That's it, yeah.
Just those three?
Those three that you just mentioned, that's it. They cover a huge net of organizations.
Oh, I thought you wanted the karate too.
No, I'm saying it would be impossible to chase down all the private sector places like karates and dance studios and stuff like that. I think that'd just be a real big waste of your time and the inspector's time to try to do that just from an information standpoint. In other words, there's no complaint. We're just trying to give you this information. I think that'd be.
Yep. I talked to Jenna today many times.
That's too hard.
Yeah. Well, Jenna's all set, because I talked to her many times today. I have a meeting with Austin Prep next week, and I'll go visit the ice arena next week as well.
Great.
What about the Y?
I was just thinking about that for swimming.
Yeah, I would think they have swimming. They may have other organized activities. There would probably be a third place that would be useful to talk to.
They have already been inspected, and they also have camps. So they're permitted and they're updated. And if they have any other events, they let us know.
They do. Okay.
Like
good.
if they're doing swimming classes. I mean, so you're thinking of not letting them know this new guidance because they'll tell us if they like add a swimming class or something?
We can let them know, yeah.
Okay. So maybe ice skating, Austin Prep, and YMCA.
Yeah.
And then Jenna has done fields. Sound good?
That sounds good.
And
Great. All right. Oh, just sort of a public health note. I have heard that there are people who have been wearing masks that are vented because it's easier for them to breathe, but those are not in compliance with the governor's order. So the point of the mask is to be a complete covering. You know, the face covering can be made of different materials, cloth materials, but if it has holes in it, that defeats a lot of the purpose of the mask. So the vented masks are not in compliance with the governor's orders.
Yes.
Okay, just trying to skim through my last notes here. Just as a note, sorry, you probably have already realized we're postponing the master plan discussion until next week when Paula is here. That was supposed to be on 8/20. And then I think the last things that I have are about the reopening protocol. So we talked about this at command. And I think Bob was going to communicate at the next department head meeting the Board of Health decision to have everyone fill out the checklist and the self-certification form. So he said he was going to get back in touch with me. I haven't heard from him about that, so I don't know if he was able to communicate about that. And then during the command meeting, he said that the town hall was all good, that they had gone through the checklist and were doing all of those things. So I don't know if it made sense for, just so that we kind of, if we're thinking all the buildings, okay, DPW, town hall, library, you know, our protocol was to, or our motion was to have a written record that Laura could have on file and refer to if needed. So I don't know if it would make sense for, like, I don't know, like Laura to basically fill out the checklist and then Jean or Bob would sign off on it just so that we have that written record for each of the buildings. You know, I'm anticipating that we would have that for each building.
I was in the department head meeting today and we did discuss it. So Bob went over it in quite a lot of detail with the fellow department heads. And it was my understanding that he was going to be preparing something so that the board has it.
Okay.
Great. Yeah, because I know there was some question about, you know, he saying he wasn't sure what the board wanted to see. And from my perspective, I just want to have some assurance that, you know, that the things that we discussed have actually taken place and that staff are, you know, informed and feel comfortable. And that I just want to have that set, because I know there was a lot of back and forth about it, and there was questions about, well, what does training look like and how does it work in this building? And I think that we want to just close that loop, as I'm sure everybody does. Great. Eleanor, if I may, Bob raised another question during command. It was about that department heads were expressing some concern about the 72-hour standard for travelers returning and the concern of exposure if someone tested 72 hours prior to return and then had been exposed to, had somehow been exposed or contracted COVID, and how did we know that people were safe? So I did a little digging to see what the background was on that. I couldn't find any clinical evidence, and I don't know if would have any comment on that. It seems to be based on current best practice turnaround time for testing results. So yeah, I mean, there are things that an employer can put in place if they feel like they need more protection than that test. Those are things for an employer to consider. It could be things like asking folks to continue to quarantine even though they have a negative test, or asking people to work from home if that is a viable option, or even possibly asking that folks submit to another test before they return into the building. I think that one gets into definitely a gray area. I'm sure that would have to be a cost borne by the employer if we were going to require that. And all the questions we had about requiring testing for poll workers apply. So, complex. So there are some remedies, but there's not anything. There's not anything clinical that I could come up with, and he had asked if the board had discussed it, so I wanted to raise what I had discovered and see if anyone had any other thoughts, so that we can address it when we talk with Bob again on Monday.
Thank you. I have not done any more research on that. I appreciate your. Yeah, well, sorry, just trying to write that down for the purpose of the note. I do think that it would be useful to have this conversation again with command, as you're suggesting. I did take probably too much time to write up some notes about I had mentioned having a call with Zoom with an epidemiologist who was open on the reopening task force for Merrimack. And so I put together some thoughts about the value of surveillance testing, the specificity and sensitivity of the test, that type of thing, temperature taking, the kind of pros and cons there. I mean, my sort of takeaway after spending like over an hour typing up this document and like reading through research, I kind of came to the conclusion I probably could have just said what I had said and not needed to get all these papers. But it really does seem like the risk of someone having a normal body temperature that's anywhere near 100 is so remote that it's not a concern. Like less than 1% of the population would have that. And if they did happen to have that type of temperature, then they could track that for maybe 5 days and their doctor could sign off that this is a person who runs incredibly hot. And I think that the false positive from a COVID test was a scenario where, after kind of calculating out I guess I can just show you what the numbers are. I don't know if it's useful for me to kind of walk through this. I could either just send this to everybody if it's helpful, talk through one example now, never talk about it again. I mean, I'm not going to say that because I do think it's important for us to think through. We have tended to be guided by, I know that we placed a lot of weight in what Christine was saying, which I've utterly valued and really think is important. And in my conversations with, I know that same conversation was had between clinicians and epidemiologists here. And I just kind of wanted to give the other perspective because they wound up deciding to do regular testing, which I don't really think is practical. I don't think that the town would be able to, it's so expensive. I can't remember now, but maybe like $1 million for the year or something to have this testing. And they're getting a discount on it because the Broad Institute is an organization that's working with universities and colleges in the area to provide the tests for less.
Yeah.
And I think, I mean, sort of at the end of the day, the takeaway is that if we're not able to provide those tests, then even if it would be great to be able to get those asymptomatic people out of the population, because if 40% of the population is walking around asymptomatic, but could be transmitting COVID, you're not catching them with a temp check or a health screening, then, I mean, the best thing that you can do is really just allow people who are concerned to be home, to work from home. If it's really cost prohibitive to do surveillance testing, which it sounds like it is, and I can't remember if $1 million is the right number, if it was some other number that was cited by the president was like 20 million, the president of Merrimack. I think that was,
Sorry, I thought you were done.
oh, sorry.
So I want to just kind of separate the issues. So the question Bob raised was specific to travelers returning from vacation. So those individuals, and then I think this other question is also valid. I mean, there's this other topic of what about the general public and how our risk of exposure to them. But then there was a specific concern about what to do about employees who may be returning from travel to hotspots and what to do about this policy and how it would, why the policy was 72 and what else could happen. So I think the two pieces are worthy of conversation. I'm not in favor of suggesting that the town need to do surveillance testing. I think the application in higher education is very valid. I have a college age student who's very responsible, but I know that he's unusual, and even he is, it's pretty hard, Mom, in these environments. Not everybody wants to, everybody forgets. There are some risks with that group that it's worth, well, the colleges have made the decision that it's worthwhile to them to pursue that. But I don't see that application in our circumstances.
Yeah, I mean, the one thing that we talked about was with poll workers, that would it be more comforting for poll workers if they at least knew that their peers were having a temp check. Previously, we decided against having poll workers be tested for a variety of reasons. And I think I'm just reevaluating whether or not encouraging testing could actually be a good idea, because you would be catching those asymptomatic people. I know that Laura's really concerned, Laura Jim is concerned that we won't have enough people who can work the polls. Although starting August 15th, I think at least 17-year-olds and maybe 16-year-olds, if can work, can become poll workers if by the 15th there aren't enough. So anyway, why don't I start?
I thought that the decision was that yes, people would go through that people were going to be asked to kind of take their temp and assess how they felt the day before, but that we had ruled out testing. And I remember Rick had some very thoughtful things to say, which I can't remember now, but I remember him sort of talking about the merits of either strategy, and that we had come to the conclusion that there were complications with that it would be, we would share information with poll workers about where testing was available, but that we could not compel people to be tested. And I Rick, I don't know, I'm sorry to put you on the spot, but I don't know if you recall those great words you had for us about the different approaches.
Well, I think the question was testing, in this case, the poll workers, whether it was to protect them or to protect the voters, and to be able to know that if someone was positive, then you would be able to publicize that. But I think with the sensitivity and specificity issues, and the complexity of interpreting it, perhaps giving even false assurances if the test is negative when someone has in fact a carrier. I mean, there's just too much complexity, and so that's why we decided to go, put testing aside, at least for the poll workers, and just do what we decided, the screening and the tape and so forth. I think the out-of-state policy, the 72-hour testing or 14-day quarantine, is sort of, to me, it's kind of like the best you can do in a bad situation, because the even if you have a negative test and you're coming from Houston, Texas, and you have a negative test 72 hours before, you don't know by the time you got on the plane whether
Correct.
you're positive. And so, again, is it false reassurance or not? It's kind of like the best you can do. I think that's probably what the state decided. And, probably the best you can do is quarantine someone for 14 days, put them in their house, and if they don't have symptoms, you are 100% sure. And at that point, they wouldn't even be carriers, I don't think, at 14 days. But that's not really practical.
Right.
So I'm not sure, Eleanor, what we're getting to. Are you, actually, Carrie, you raised the issue around testing with respect to town employees going back? Is that?
That was how it came to us. Bob, at the town manager at our command meeting, mentioned that there had been some expressions of concern amongst department managers of was this standard actually providing safety? Was it safe to have people who had traveled from a hotspot, if they came in with a test 72 hours prior to return that was clean, was that actually safe? And he wanted to know if we had talked about it, and I went and looked into the how did we get there? And that's where, so I come to the place of there is recourse that an employer can take. And I think that's a discussion for the employer to have of how they might handle that, if they wanted to require people, in addition to showing a negative test, did they want to require people to quarantine for the 14-day period, as you say? Do they want to require people to work from home? There are things the employer can do, and that's up to them.
So I'm thinking ahead to the agenda for Monday that you're not going to receive. We're going to make now. It sounds like this is one item on it, is that we'll continue this conversation about what the town can do as an employer to help make sure that everyone's safe after traveling. We will circle back about reopening protocols if there's any question there.
Mm-hmm.
Are there other topics that we've talked about?
The enforcement issue with the police chief.
Right. Okay. So 3 agenda items, unless we've got any more for Monday. And then I think, just because I took the time to write this document, I'll say on open meeting, I'm going to send you this document, wound up writing, that has information about surveillance testing, specificity, and sensitivity.
That's great. Thank you.
I probably should have been typing meeting minutes. I have 2 outstanding. But I'll do that by Monday. I think that's everything that I had. Yep, I think that's everything that I had. Yeah.
So can I just, you're posted for the COVID-19 discussion on Monday and for the board reorganization. And I know the discussion earlier was maybe the board will think about a little bit more whether it makes sense to have that reorganization then or not. The one thing you might think about is if you can decide on a meeting schedule going forward, then I think that will facilitate trying to appoint a new member. Because we're kind of in this catch-22 where we don't have a member because the members that are interested or the applicants that are interested can't meet the current.
Meetings, right?
So in order to see if maybe some of those might be viable candidates that the board could appoint, one. Maybe if the board wants to think about a meeting schedule, they have to decide now, but as part of the discussion on Monday, to think about what would a meeting schedule look like going forward. I know the fire chief was asking, is it helpful to meet with command? And if that's, it sounded like board members felt that it was. So it is rescheduling command an option? Is just having one person or rotating with command? Maybe board members rotate, is there a way to still stay connected to command, but not make that a formalized meeting on Monday mornings? Because it sounds like there are candidates that would be interested in being on the board, but for that Monday morning issue.
And I just want to point out one thing too, for Rick's benefit. Associate members can put in for full voting members.
Thank you. That's a good point.
As well, if you had any interest in doing that, and then they would be appointing an associate member who wouldn't feel the need to have to come to every single meeting. Certainly, and it's always been a good way for associate membership's been an excellent for the town of Reading, the format that folks can kind of get on, get their feet wet, see if they are interested in this, in the board, see how it acts before they go on to full membership. But a lot of times that's what happens is an associate member puts in for the position that comes up as a full voting member. So again, just for Rick, for your insight, not to put any pressure on you, but just to give you the heads up on that.
Okay, thank you, Kevin.
And are always looked more favorably than folks that aren't already on the board, just because you kind of know what you're getting into, you've been in it, you know what I mean? So it certainly gets looked on favorably from that regard.
Great. Did I hear the fire chief talking about changing the command meeting frequency? Is there some discussion about that, going from once a week to every other week? Did he mention that?
Right. Yeah, you're totally right. I forgot about that. I think he asked if we could go down to once every other week for a command, or what people thought about doing every 2 weeks. And then my response was, well, there's going to be a new chair on Monday, the 17th. Should we postpone until then to see what the new board wants to do? That's a good point. So that might be two changes. One is potentially having the board meetings be Thursday nights at 7, so once a week, and then rotating a board member to go to the command meeting every 2 weeks would significantly decrease the meeting schedule. Yep. So, two things to keep in mind. Any other last thoughts?
On that.
Kevin, I want to know where our little friend is to come say goodnight.
Early, our meeting can't end now.
The other one just walked out of the cave and came down the stairs. I don't know if anyone noticed that.
I did.
Not try to end this meeting, but there is tree lawn on there.
My
I would assume that was there for like maybe an update standpoint, because again, the last I knew, this is nothing in our ball in our lap as of right now.
Yeah, I thought it had gone to the select board. Is there an update?
That's when I looked back on it, it was this board had completed the work, and it was with the select board.
Okay.
Okay. Yeah, that's how I remembered as well. Okay.
Me
I
too.
just saw it on there, so I thought we should mention it. Okay.
Thank you.
Thank you, Kevin.
Okay. So at some point, should I reach out to the select board and say, I guess it's not an urgent thing right now, but we are talking about return to new normal.
Yeah, I think you can, if you want to reach out to the chair and just say, connect with the new chair of the Board of Health on this. Last we left it off, the two boards needed to come together and I think have a formal discussion.
When did we leave that off? January? Maybe even.
Like, probably,
Later.
probably even earlier than that. No, it was earlier than that. The board
Yeah.
select board got really busy, and then November, December, and in January. And then by the time we got around to February, we said, well, you're really not going to be able to institute it for this spring. So there wasn't a lot of urgency, and then
Right,
the rest is history.
right.
And then the world turned upside down.
Yeah.
All right. Well, thank you for reminding me of the last agenda item. Any other final but important comments? Nothing?
Nope.
Laura?
Got nothing.
All right. I'll entertain
Nope,
a motion.
nothing.
Nothing? All right. I'll entertain a motion to adjourn.
Motion to adjourn.
Oh, Carrie, motion. Eleanor, seconds. Roll call.
Carrie, yes.
Eleanor, yes.
All right. Good night, everybody.
Thank you guys. Good
Night.
night. Take care.